34 million. That's how many people in the United States have type 2 diabetes. That's a huge number, right? But did you know that the leading cause of death and disability for people with type 2 diabetes is actually cardiovascular disease? Whether you have diabetes or a loved one does, it's important to know how you can lower the risk for heart disease. Today we're taking a deep dive into diabetes to learn how patients can lower their risk of cardiovascular disease and improve their health and overall quality of life. First though, let's define diabetes. Type 1 diabetes is an autoimmune disease that occurs in children and adults and seems to have a genetic component. There is currently no cure. Type 2 diabetes is when the body can't regulate and use sugar, which is also called glucose. This leads to too much sugar circulating in the blood. This type is often diagnosed later in life. People with type 2 diabetes are 2 to 4 times more likely to develop heart failure, which is when the heart doesn't efficiently pump oxygenated blood throughout the body. Now, the vast majority of persons with diabetes work very hard to manage their condition and reduce their heart disease risk factors. But there are challenges that get in the way, such as access to health care, taking medications as prescribed, gender, lifestyle changes, and socioeconomic factors. In fact, we know that many Black and Hispanic people who have type 2 diabetes in the United States often don't get the recommended follow-up health care after being diagnosed with heart failure. We recommend that patients attend a follow-up appointment within 7 to 14 days of their release when hospitalized with heart failure. Women with diabetes have a twofold increased risk of heart disease as compared to men. They're also more likely to have heart attacks, often fatal, earlier. Why is this? Many women have multiple risk factors for heart disease by the time they are diagnosed with type 2 diabetes. First, women experience a decline in estrogen as they age, and estrogen helps protect against inflammation. Second, women often have a slew of classic cardiovascular risk factors, including high cholesterol, high blood pressure, abdominal obesity, and abnormalities in blood vessel function. Sadly, women often receive less aggressive treatment for these cardiovascular risk factors. And now, new research points out that stress may also play a role in the development of type 2 diabetes in women. This includes chronic stressors such as work, family, and finances, as well as acute stressors such as traumatic life events. The third group of patients I want to call attention to are Black and Hispanic children with type 1 diabetes. A recent study found they are more likely than their white peers to develop stiffened arteries, which means the heart has to work harder to pump blood through the body. Typically, this condition is seen in older adults, which is why it is so concerning to see it in young people. Type 1 diabetes is increasing about 2% per year in the United States and even faster among Hispanic and Black persons. People with type 1 diabetes are about 10 times more likely to develop cardiovascular disease than those who don't have it. Hispanic and Black children in particular bear a higher risk for complications for diabetes due to socioeconomic factors, including limited access to medication and monitoring tools such as insulin pumps. They also tend to have higher cardiovascular risk factors, such as not maintaining a healthy weight. All this to say, as healthcare professionals, we need and want to find ways to encourage and ensure all our patients can easily get the health care they deserve. Now, if you or your loved one is the patient, I want to offer some insight to help you manage your cardiovascular risk. First, advocate for your care. This means you need to see your doctor regularly and follow through on all scheduled appointments. Ask questions. I'm going to repeat, ask questions, follow up, and get second opinions. Listen to your body. If you feel strange, jot down the date and any notes about what was going on. If you think of questions, write those down. Share your notes with your doctor at your next checkup or sooner if needed. Second, stay aware of and track these 5 critical health numbers: total cholesterol, LDL cholesterol, which is the bad kind, blood pressure, blood sugar, and body mass index or BMI. Your doctor will provide these numbers after you visit with him or her. It's important you learn about these and track them. Third, take your medications as prescribed and work closely with your doctor to monitor any changes needed in your medication. Fourth, incorporate physical activity into your daily life. We recommend at least 150 minutes of moderate intensity aerobic activity or 75 minutes of vigorous activity every week. Let me do the math for you. 150 minutes over a week is about 30 minutes a day, 5 days a week. In addition to the activity, muscle strengthening activities 2 days a week are recommended. Brisk walking, bike rides, swimming, yoga, aerobics are all good forms of physical activity. I'm a fan of running. Actually, I call it slogging anymore, slow jogging. And my wife and I really love to dance. That's another form of physical activity. Remember, even a little bit of activity is better than none. And if you need to, start small with 5 to 10 minutes a day. Walk to the corner. Go up and down the stairs in your house more times than you need to if you have stairs. And as the weeks go by, you will find that you can do more and more and more. Fifth, manage your weight and do your best to eat a healthy diet. Repeated studies have linked a Mediterranean-style eating pattern to lower cardiovascular risk. That would include fresh fruits and vegetables, nuts, beans, and whole grains. Olive oil and fish are good choices. It's also key to limit red and processed meats, sugary sweets, processed foods, and some dairy. Sixth, keep learning. Empower yourself with the information on the American Heart Association website to help you better understand your heart health and what you can do to treat any issues. And last, but certainly not least, don't smoke. Cigarette smoking and secondhand smoke exposure are responsible for nearly 1 in 5 deaths in the United States year after year. So remember, people with type 1 and type 2 diabetes are at higher risk for cardiovascular disease, but if you have diabetes, you can lessen that risk by implementing the strategies that I listed out in your lifestyle. If you have questions about health conditions, I would love to hear from you. Comment below, hit subscribe, join me here next time for answers that you can trust.